Johnson & Johnson could apply for emergency use authorization for its coronavirus vaccine as soon as next week. The company's vaccine trial results showed it was 85% effective against severe cases of COVID-19. But as the U.S. works to get enough shots for everyone, a new, more contagious strain of the coronavirus has turned up here for the very first time. 2 people in South Carolina tested positive for the variant, which was first identified in South Africa. Mola Lenghi reports.
Well, vaccination sites like this one have recently reopened after the federal government started increasing the number of doses it sent to states. But supply is still a concern, and the rollout is still going slower than many had hoped.
The need to vaccinate as many Americans as possible is more urgent than ever, as the variant of COVID-19 first identified in South Africa has now been found in the U.S. It was detected in 2 people from South Carolina, from separate parts of the state.
There is no known travel history, and there is no known connection between the 2 cases.
With highly contagious variants reported in at least 28 other states, officials should think carefully before relaxing COVID restrictions, warns Dr. Ashish Jha.
By mid to late March, these variants to be quite common and dominant in the United States. We could see huge spikes in cases, large spikes in hospitalizations and deaths.
And the slow vaccination process could make things worse.
The longer we take, the more there are going to be opportunities for variants that could become even more dangerous, more lethal, more contagious, or just escape our vaccines altogether.
So far, the currently authorized slate of vaccines remain effective on all known strains, though preliminary findings suggest they may offer reduced protection against the variant originally detected in South Africa. But the work to understand these new strains and their interactions with existing treatments is well underway. Earlier this month, we visited Dr. Dan Baru, the director of the Center for Virology and Vaccine Research in Boston.
If the vaccine is not as effective on the new variant, what then?
Well, fortunately, the first 2 vaccines that we have here in the United States have proven to be highly, highly effective. In the worst case scenario, then vaccines might need to be updated.
And companies are already working on those updates. Both Moderna and Pfizer are developing booster shots for the South African variant of the virus. Vlad, Anne-Marie?
All right, Mola, thank you very much. I want to bring in Dr. Bob Lahita. He's a professor of medicine at the New York Medical College and chairman of medicine at St. Joseph University Hospital. So, Dr. Bob, I want to start with that variant that showed up in South Carolina. The 2 people who tested positive haven't traveled anywhere. They don't know each other, and they were from different parts of the state. So what's going on here?
Well, it's possible that the mutant actually appeared in them for the first time. You know, as we know, this virus mutates. It's what viruses do, as I have said, but the mutation is a very specific change in what we call the RNA bases, and then subsequently the amino acids that are produced that make up the spike protein. And so the fact that they both develop this mutation means that this is very successful mutation for this virus. The virus is using things that will allow it to attach to cells and receptors on those cells with efficiency. So I think this is what's going on. I've been looking at all the various variants in the RNA molecule. There are 30,000, can you believe it? 30,000 RNA bases that are involved in the RNA molecule, and of those, about 1,700 involve the spike protein. So a little alteration on any one of those changes the stickiness of the spike protein for the receptor in your body. That's what makes it more infective. It sticks with greater firmness and allows the cell to be infected easier. Vlad?
So, Doctor, Novavax says that their vaccine is 89% effective overall, but when they tested it with the variant that was identified in South Africa, it was only 49% effective. Point out, these are studies done by the drug maker, not peer-reviewed, as many of the studies that we are talking about are. Moderna announced a similar result this week, saying that the vaccine was effective, but less effective against the variant that was first found in South Africa. So why is this happening? What is it about the variant identified in South Africa that's making it a little more concerning than, say, the variant that was identified in the UK?
Well, again, the spike protein has three major components. It's stereochemically, which means it's the shape of the spike protein that gives it its efficiency. And the vaccine is the antibody sits on the spike protein in a certain way. If the shape of the spike protein changes to allow it to be stickier with regard to the cell, the antibody is not going to be as tightly attached to the spike protein in the vaccine. So it's going to fall off and or perhaps will not stick to as many spike variants as we would like. So consequently, the vaccine is not as efficient, although the data currently would indicate that both the Moderna and the Pfizer vaccines are fairly effective against this new variant. The Johnson & Johnson vaccine is effective against the variant, but not as efficiently. And the Novavax vaccine, which is protein-based, is also efficient. Let's say it's almost as efficient, if not as efficient, as the average flu vaccine. So I don't think people have to be worried about this. I don't think we have to wring our hands and say, oh my gosh, now we have a vaccine that doesn't work. That's not the case. Because remember, Anne-Marie, we also have the cellular immune response, the T cells, and other things that are very effective in combating the virus, not just the adaptive immune response, which is responsible for production of antibodies. So these antibodies that come in via the vaccine are effective, but perhaps not as effective as we would like as we go forward with this mutation.
So, Dr. Lahita, Johnson & Johnson also said this morning that their vaccine, which only requires one dose, was 85% effective against severe cases of COVID-19. They expect to file for emergency use authorization in early February, which could be any day now. How will this affect things here in the U.S., especially with people missing out on getting their second shot or getting it late?
That Vlad is a one-shot deal, and Johnson & Johnson is what we call a viral vector vaccine. That is using an innocuous virus to take parts of the coronavirus protein into the body and infect the cells. The virus is the virus that's carrying the corona particles, or the part of the genome, is harmless. So it's very effective, and it's, as you said, a one-shot deal, and that's good news for everybody, because that's going to mean that we're going to have indeed another vaccine. We should have by April like 4 or 5 new vaccines that will help combat this COVID-19 pandemic. But it's also interesting that it's only a one-shot deal, which means you don't have to have 2 injections.
The story that we just ran before you, Mola Lenghi's story, he said that Moderna and Pfizer are both working on boosters to deal with these emerging variants. Does that concern you? I mean, already it's tough to get people out to get the first shot. And now, you know, for 2 of these vaccines at least, they have to get a double shot. Now there might be even a 3rd shot. Are you concerned that you know, people just may not follow up, and then what we're aiming for, which is herd immunity, may be more elusive than ever?
Yes, Anne-Marie, the 3rd shot is just out there as a possibility. Now, you got to understand, with messenger RNA vaccines, the messenger RNA is relatively easy to tweak. And you can tweak it to really adapt to almost any variant that arises of the virus. It takes a little while, but we can tweak it and get a 3rd injection. And you're absolutely right. People are having problems coming back for the 2nd injection. I can't imagine a vast movement to get even yet a 3rd injection. But again, if we understand the science says that the messenger RNA vaccine is easy to change. And that's what Moderna and Pfizer are doing. But they're saying that, you know, hey, we have a vaccine that is good for at least 3 to 4, maybe even 5 years at the present time. And they have shown, the science has shown, that these messenger RNA vaccines are effective against both the South African variant and the UK variant. And again, these variants are going to pop up, so we better be ready for them. And when we do analysis, everybody should not get hysterical and realize that that's what viruses do. They like to mutate. And some of these mutations are going to affect the efficacy of the vaccine.
So, Dr. Bob, you got the 2nd shot of the vaccine a few weeks ago. How are you doing?
I'm doing great. I am doing terrific. I feel like I am really very, very healthy. I have had no pain, no weakness, no anything. It's been fantastic, Vlad.
Fantastic.
That is good news, Doctor. In the meantime, Vlad and I wait. We'll be doubling up on our masks or whatever people are suggesting lately.
I look
Dr.
over, it's my
Lahita,
double
thank you so
mask here.
much.
Yeah, that's what we're doing.
Good. Thank you, Dr. Bob. Have a good weekend.
You too.